This is a 7 News on Your Side Town Hall, celebrating Hispanic Heritage Month.
Welcome, welcome. We thank you for joining us for this special Hispanic Heritage Town Hall discussion. I'm Michelle Marsh.
I'm Ashley Rodriguez, and tonight we're welcoming a group of local Hispanic leaders for a conversation about the most pressing issues in the Hispanic community right now, especially here in the DMV.
So joining us tonight, Nicole Quiroga, the president and CEO of the Greater Washington Hispanic Chamber of Commerce, Abel Nunez, the executive director of the Central American Resources Center,
Bibi Otero, Special Assistant for the Office of Montgomery County's Executive, and Dr. Elena Rios, the President and CEO of the National Hispanic Medical Association. Thank you all for being here tonight. We appreciate it.
Before we get to our panel discussion, let's take a look at how COVID-19 has disproportionately impacted the Hispanic community. Hispanics are more likely to end up in the hospital and die from the virus.
Just awful statistics, and the National Hispanic Medical Association believes vaccines can reverse this trend, but there are some hurdles in the way. Throughout this pandemic, we've all heard the messaging: wear a mask, wash your hands, get COVID tests, and sign up for the shot. But the National Hispanic Medical Association found it wasn't resonating among the Hispanic community.
We decided that all of the messages were about individuals and the individual's responsibility. Get your shot, right? All of that was very important. But we thought in the Latino community, it's more important to think about families and to try to get to the heart of our culture.
DC-based Dr. Elena Rios is the president and CEO of the association, and she tells me after receiving a CDC grant, the organization launched Vacunas para Todos, or Vaccines for All, an outreach campaign using Hispanics in the medical field to educate families about the importance of getting vaccinated. Public service ads appear on Spanish-language television, social media, and through community events.
I think the most important messages for the Latino community is that it's free. You don't have to have insurance, and nobody's going to ask you for any kind of documentation.
According to the CDC, Hispanics are 1.3 times more likely to be hospitalized from coronavirus, 2.3 times more likely to die from it, and vaccination rates are severely lower compared to their white counterparts. Dr. Rios believes solutions to this disparity include granting immigrants citizenship so they can get health insurance, giving essential workers paid time off to go get the shot, and for small businesses who employ essential workers to have mandates requiring vaccines.
In Washington, D.C., only 14% of Hispanics are vaccinated right now. There's a lot of work to be done.
And on that note, let's get right to our panel. Joining us is Dr. Rios, who you just heard from. She's here live. Dr. Rios, let's start with you. As you just saw, and as we talked about, Hispanics were hit so hard by COVID, disproportionately hard. In fact, a Pew Research report in July revealed about half of Latinos say that a family member or close friend was hospitalized or even died from COVID-19. And you know, when I see stats like that, the first thing that comes to mind is the number of Hispanics that we saw working throughout the pandemic. When we were all inside, quarantining, hiding from the virus, they were out there. I'm sure that played a role in the high COVID numbers in Hispanic communities. But what are some of the other contributing factors in your opinion?
Well, I think the high exposure to COVID because they're working, what we call essential workers, but also families just getting together all the time. Especially with elderly, young people, the adults, their children want to visit their grandparents, and staying away from each other is very, very difficult. And also just living in multi-generational households, and then just having the ability to get to the vaccinations or having access to vaccinations.
That access is so critical.